So this is the making of a synovial joint for my materials. I have a 1x1 piece of wood here. I also have plasticine that can actually bake, so I'll be putting that in the oven. And then I have foam, which I've been modeling to look like the femur where it meets the knee. Okay, so Clay says I'll be able to bake. Hopefully the foam and the wood inside can stand up to 230 degrees Celsius. If not, I'll be in the news. So the bones turned out well out of the oven, and now I'll be attaching the ligaments using this stretchy material and attaching it with Gorilla Glue. So now some of the ligaments have been attached. We can see the ACL, the PCL posterior, the MCL, the medial, and the LCL, the lateral, and also the meniscus is now in the pink. And we also have the articulate surface in yellow. So here we can see the ACL, and the white here is our PCL. So further progress has been made on the knee joint, as the popliteus, seen here, has now been attached. I'll be going through the labels now on my knee joint. Number 1, we have the femur. Number 2, we have the patella, and I'll be removing that just so you're able to see inside easier. 2. 3, we have the tibia. 4, we have the fibula. 5, we have the meniscus. 6, we have in yellow the articulate cartilage. 7, we have the ACL down in there. You can see it. Try to get it for you able to see. 7. 8, we have the PCL, so 1 second. And that's number 8 there. And I'll be removing that just so I'm able to maneuver the knee better. 9, we have the MCL, medial collateral ligament. 10, we have the LCL, lateral collateral ligament. 11, we have the patella tendon. 12 and 13, we have the lateral condyle right there. And 13, we have the medial condyle. 17, we have the tibial tuberosity. 18, we have the hamstring here, which would be stretching up and attaching to the pelvis actually. And 19, we have the popliteus. Once again, if you'll bear with me. And 19, the popliteus right there with the white pin. I'll be going over the movements of the knee now, as I have already labeled it in a previous video. So there are a couple main components to the knee. There's the 4 bones that make it up. You have the femur, you have the patella, you have the tibia, and you have the fibula. Okay, and you have primary supporters and secondary supporters. The primary supporters are your ACL, you can't see in there. PCL, your posterior cruciate ligament. Your MCL, your medial cruciate ligament, and your LCL, your lateral cruciate ligament, okay? So the medial and lateral cruciate ligament stops them from going side to side movement there, while your ACL and your MCL are when it's extending like this, as you can see here. 1 second, and just like that there. Pause it. Did you stop it? Okay. So further movements of the knee are promoted by the secondary structures. So we have the meniscus there, and that is used as a shock absorber for the knee. but also prevents the femur from moving out of the joint as it's rounded up at the top there. We also have the popliteus. It's a ligament out the back here, and it stops a little bit from rotation and movement as well. Also here we have the hamstring, which we attached up to the pelvis, and you can feel it on the back of your knee when you're doing it there. So our knee can move in two main places. It can move side to side. There's a little bit of rotation and flexion and extension here. So flexion and extension. Pause. Okay, so today I'm going to be talking about an injury that is commonly seen in the knee. I'm going to be avoiding the ACL as many people talk about that. But I'm actually going to talk about the articulate cartilage here that we can see on the inner femur there, and it's also on the inside of the patella there. So what's important about the articulate cartilage is it actually doesn't have nerves on it. So when we're walking down the street there, it's bouncing up and down, bouncing up and down, bouncing up and down there, it isn't painful to walk, and that's because there are no nerves there. So you don't feel it as it's rubbing and bouncing up and down the end there. But when you develop arthritis, and there's actually the breakdown of that cartilage where there's no more cartilage there anymore, your bone has nerves there. So now as you're walking along, that's when you can feel the pain. That's when you feel the grinding, when you're moving your knee about, and you can feel the grinding pain. So that's a common injury is arthritis. Okay, so with that, the arthritis, as you know, that can be a problem there. So there are three main components that can help fix it. There's anti-inflammatory drugs that you can take. You can actually take steroid injections into your knee. And as an absolute last resort, if the patient is seen as needing it, you can have a total knee replacement. So in finale, I'm just going to be going my flexion and extension, as I know that is very, as you can see, the knee is fully flexed there. Perfect.